Did you know that there's a rare breast tumor that can grow very quickly? It can mimic a common benign lump called fibroadenoma, yet in some cases it can grow to the size of a football within just a few months. So here's the important part. Not every rapidly growing breast lump is a breast cancer, and some large breast tumors, even if benign, will still need urgent medical attention. So today, let me tell you about a very rare, often benign and treatable breast tumor called Phyllodes tumor. What is a Phyllodes tumor? Phyllodes tumors are very rare breast tumors, making up less than 1% of all breast tumors. They arise from the connective tissue or the stroma of the breast, and not from the milk ducts or the lobules where typical breast cancers usually develop. Now, although most Phyllodes tumors are benign, some can become borderline as well as malignant potential. Classification. Phyllodes tumors are divided into three categories: benign, which is a non-cancerous, usually comprise about 70 to 80%, borderline variant, as well as the malignant cancerous type, which is about 10 to 20%. Benign Phyllodes tumor. This is the most common type, making up about 60 to 75% of the cases. They are non-cancerous and usually treatable with surgery, but they can still come back if it's not completely removed. Borderline Phyllodes tumor. This type is less common, accounting for about 10 to 20%, and borderline tumors have features between benign and malignant potential, meaning that they all can behave more aggressively and also have a higher risk of recurrence. Malignant Phyllodes tumor, this is the rarest form and also commonly comprised between 10 to 20%. They are the cancerous tumors and considered as a type of breast sarcoma. They will spread through the bloodstream and rather than the lymph nodes. Symptoms and presentations. Phyllodes tumors are usually painless breast lumps. However, unlike common fibroadenomas, they can grow very rapidly. So in some cases, they become extremely large, sometimes reaching the size of a football or even a watermelon if it is left untreated. Diagnosis and investigation. One of the biggest challenges is that Phyllodes tumor can closely mimic benign fibroadenomas on scans such as ultrasound and mammogram. So even core needle biopsy may not always definitely distinguish between the fibroadenoma as well as the Phyllodes tumors. And because of this uncertainty, complete surgical removal is often necessary for accurate diagnosis and treatment. The important point here is that core needle biopsy is still essential to rule out invasive breast cancer, because invasive ductal carcinoma may require chemotherapy, which is a different kind of treatment, before surgery, whereas if it's Phyllodes tumors, they are primarily treated surgically. Treatment of Phyllodes tumor. The main treatment for Phyllodes tumor is surgery. And the goal for this is for complete removal, white clear margins, as well as to reduce the recurrent risk. This means that surgeons often remove not just the tumor but also a rim of healthy tissue around it. So for very large tumors, sometimes there is a need to remove excess skin, or even we can do reconstructive surgery may be needed. So the key fact is that Phyllodes tumors generally do not respond well to traditional breast cancer treatments such as chemotherapy, hormonal therapy, or targeted therapy. A good surgical excision offers the best chance of cure. As a follow-up, benign or borderline Phyllodes tumors will require very close follow-up. This is because the recurrence can happen, and in rare cases, future tumors may show more aggressive features. So in summary, any breast lump, especially one that is rapidly growing, should always be properly assessed through triple assessment, which is clinical examination, staging, as well as tissue biopsy. Secondly, many women delay treatment because of fear. Fear of cancer, fear of surgery, fear of losing their breast, and fear of chemotherapy. And so here's the truth. Not every breast lump is dangerous, and sometimes early treatment may require just a simple surgery. So please don't let fear stop you. Be empowered. Get yourself checked if you notice a lump. Seek treatment early, because early diagnosis can save not only your breast but also your peace of mind. Thank you for watching. I hope this video has been helpful, and be sure to check out my other videos and for more breast health information, and let me know in the comments what topics you would like me to cover next time.